Hi, I'm Dr. Ambridge, and I would like to just orient you to a few exercises to help your muscular and joint orientation. I'm going to use a foam roller, and there's some creativity using a foam roller, but I want to show you some things for your back and your lower extremities for helping muscle tone and easing pain and getting more flexibility. So just follow along. If you have a foam roller, you're able to do that. You can just watch this video and do it along with me. Otherwise, just kind of orient yourselves, and you can remember next time you have a foam roller. So first of all, I'm going to have you sit down on the foam roller, and you kind of get your balance. Your feet are going to be your stabilizing factors there. I'm going to have you begin by rolling down onto the foam roller gently. Now you're going to do this to a comfort level. Some people may have more pain or may not be able to begin this yet due to their acute injury. So as you come onto the foam roller, your lower back has a curve in this position. Your upper back has an opposite curve. So in the low back, I keep my hands down towards my hips, and then I let my hips drop. I don't raise them up. I let them drop. Now you're trying to stay relaxed in your muscle tone, so you're actually getting joint motion as well as muscle impact. So you just roll back and forth in through here, and you just feel some areas. In those areas that feel a little tight or a little restricted, you can kind of spend a little extra time there. Again, you're working on trying to keep relaxed. In your upper back, you walk yourself with your feet, roll yourself up. I bring my arms up here and my head back, and I'm just stretching, getting some motion there. It always feels so good. Now, if this is too tender, then you may need to modify it, or you may need to do some other stretches and get better in your acute pain before you can do this. Okay. The other exercise you can do is simply by laying on the foam roller where it's parallel to your spine. You lay on the back, such as this, where your head's resting and your tailbone is resting, and you can roll yourself side to side. There's lots of exercises you can do with this. You can raise opposite arm and leg. You can put a 2-pound weight in there. There's a lot of balancing kinds of exercises you do. For this purpose of this video, we're just looking at easing muscle tone and increasing motion in your structure. So side to side again. Now, after that, I'm going to suggest that you roll out your lower extremities. I'm going to show you one side for the purposes of time on the video. But you're going to cross your leg, which changes the tone of your gluteal muscles on the affected side of the crossed leg. Then you're going to lean over onto that side. So now you can roll out the muscles in your gluteal area, even far over towards the hip. You basically, you're the pie crust, this is the rolling pin. So you're going to roll your muscles out. So when you find a sore area, that's where you want to work them more. And you want to work right around the joints, the areas that are tender. You keep working those out. Okay? You're going to do that on both sides. Have you drop down to your leg, your calves. So the foam roller is just above the ankle. You cross. Ideally, you're eventually going to be crossing your leg. If it's too tender, you can start both legs like this. Crossing the leg adds a little pressure. Your hands are near your hips. As long as your shoulder integrity is good, your upper body strength. So then you roll yourself back and forth. Your toe coming inward and outward rotates the calf. You cover more muscle fibers that way. You may need to move forward a little bit to get the upper calf. Again, you roll that out. And that feels, you'll feel the pressure points, maybe tender, but if you do this consistently every day for just a few minutes, that's going to disappear. The other exercise would be to your IT band, your lateral part of your leg. So the rolled leg is going to be straight. I'm resting on the hip, my other leg across, and I'm supporting on this foot and my hands. So I'm just going to roll up and down. You want to keep your leg muscles relaxed. That's what you're trying to do. Not tighten them so much. You want them to relax and get some relaxation and circulation in those muscle tissues. You can go up and down all the way, okay? You can go onto your quad, the front. You can do that one leg at a time. You can do it both. You can actually do your adductors as well. We'll cover that in a different YouTube. So hopefully that will help you so that you can have a good routine to get your muscle structure and your joints doing better for you. Have a great day.